Hi everybody, you're joining us back live here at the Guidewell Connect Insights Lounge. My name is Kate Warnock, and I'm so pleased to bring our next guest, Mr. Rob Coppedge. Rob, welcome.
Thanks, Kate.
So Rob is he is the president of Direct Health Solutions, and we were just talking a moment ago. Here we are, here in the middle of the AHIP Institute Expo space. And you had a really interesting perspective on that. Why don't you share it with everybody?
Oh, I was just thinking how much I love this part of the conference, because every year you see the relative change in importance between which vendors are going big, which ones are diminishing in size, and just seeing how much emphasis this year is on virtual care and how much is on making some order out of all the data that's coming together in healthcare now. How are we beginning to take action out of all the insight that we have? And that's the really hard part. There's a lot of great science, but how do you make something actionable out of it?
And obviously there's special appeal for you here in the expo space because of your role back at Direct Health Solutions, which is part of Cambia.
Right.
Why don't you explain what that connection is?
Sure. So Cambia is the oldest health plan in the country. We've been in the employer-sponsored health plan business since its earliest days 100 years ago. So but innovation's been at the core of that since its beginning. I lead the diversification effort at Cambia. So the effort we have outside the health plan business to build great companies that are transforming healthcare for the consumer. So we have wholly owned businesses where we have built them internally, and we have a venture portfolio that's market leading 15, 16 companies across the nation.
So no doubt, I'm sure that there are plenty of individuals here in the expo space that would love to meet you.
Well, and we know a lot of them too, and we have a lot of our companies are here on the floor as well.
Right. All right, so Rob, you're here at AHIP Institute. You're going to be talking on a panel, is it later today or tomorrow?
It's this afternoon.
This afternoon. So why don't you tell our audience what you're going to be addressing?
So we're talking this afternoon about how strategic investors and large corporates are beginning to transform the industry through their investment strategies.
Okay.
And I think there are two big points that come out of that. The first is, if you had this talk 5 years ago, you would have had only a handful of large health plans doing this kind of work. And now you look across the floor and in the sessions, there are many, many, many strategic investors in healthcare who are trying to diversify this way. However, we're all going about it a little bit differently. And I think the challenge that's presenting itself for us is to actually take that investment and have it transform healthcare at scale. We have to change how the legacy company thinks about integrating with these innovative companies.
Right.
And it's really hard because we have large companies that are geared to do less risky, more large-scale rollouts, things that kind of move the battleship through the ocean. And we have early-stage companies that are moving much faster, need to learn at a different rate of change, a different pace. So gearing those together is the big challenge that's before us. So to actually stand up investment programs and change how your legacy business handles its interface with those innovators is the big challenge that we have now.
Absolutely. Rob, earlier in the day, we had so many interviews with some of the other speakers and thought leaders here at AHIP Institute. And one of the big themes that we keep hearing about is the customer experience.
Oh, sure.
Right? And so how do we pivot? Like you said, this legacy company has to manage risk, has to do things at scale, yet also has to be nimble enough to address the individual, to know their whole health, to really see holistically maybe the social determinants of health. Is it true that someone like a legacy system can maybe disrupt themselves to capture that kind of experience, act on it, or is it going to be through bringing in others to collaborate with them?
Well, I think it's all about the partnerships, right? But I'd say there's two kinds of legacy players. There are those that actually get it, who are making big investments into these kind of tools and technologies and services. And there are those that just keep screaming consumer louder and louder, thinking that if they say the word loud enough, it'll actually happen.
Right.
And I think what we're actually seeing is those players that aren't actually making a change in how they do business, that aren't actually partnering with the startups, with the innovators, that aren't actually partnering in new ways with other players in the market that traditionally they might not have been able to. So payers and providers working together, competitive stakeholders in markets finding ways to collaborate. If that's not happening, they're falling way behind. Those that are actually doing that work and doing it well, making investments, but actually putting investment into their own company to be able to partner effectively, those companies are doing well. And we're seeing that in Florida with GuideWell, we're seeing that with Cambia in the Northwest, and a few others across the country.
Is it possible for these legacy systems to really remain relevant if they don't move the needle and really start entering into this new space?
Well, I think we have a lot of pressures on the relevance. The consumer is going to be making more and more choices. The provider and the provider delivery systems have so much intimacy with the consumer that at the end of the day, if we don't figure out how to make ourselves relevant, the legacy health plan relevant to the consumer in new ways, that relationship moves.
Yes.
In a wholesale fashion to other players in the market.
I was going to say, or it's going to be picked off by the plan that knows
or
how
new
to
entrants.
act on it.
Yeah,
Right.
That is the risk we have in many of our markets across the country.
Right. Well, so in your role, Rob, I think that you probably have a really interesting purview on what could be the long-term play for health plans. Where do you see the industry moving in the next 5 years?
The great thing about healthcare, I think, is that to know the future of healthcare, you look at the future of every other industry 5 years ago, and you sort of see what we're going to do next. Because there's not a need for wholesale innovation in healthcare. That's a binary risk. What's needed is to look at every other industry that's data intensive in the American economy and find ways to leverage those insights and those developments. So I look at it and I say we have moved site of service away from bricks and mortar only this much over the past 10 years, 15 years, and we've called it a success. We've moved surgeries into surgery centers, and that is it. How do we take that next huge quantum leap of getting services out of bricks and mortar into a setting that's convenient for the consumer,
right,
when they need it, how they want it, transparently priced? And that, if we can just do that alone, it will disrupt so much of the calcified challenge that faces healthcare now.
Rob, I think that you might agree with Ingrid Lindbergh. She was our first interview here, and she said that most health plans really have to focus on getting the basics, get the fundamentals right, and kind of forego the delight the customer, which seems to be kind of the buzzword, and maybe that's what we hear in some other industries. Do you agree that health plans just focusing on getting the essentials right, paying the claims, being transparent with their costs, getting the information correct in the provider directory? Is this the right place to start?
Well, we have to run good businesses, but I'd say if we just focus on patching our boat, we're going to miss the challenge of the hurricane that's coming.
Okay.
So we have to think about how we leverage that legacy asset to actually move the market forward in new and innovative ways. Take virtual care and site of service shift. If we don't figure out how we use our reimbursement methodologies, how we use our provider relationships, how we use our market leverage to actually drive the delivery system and the consumer in new directions and offer them new options that previously were not available because of the third-party payer system, we will miss the opportunity entirely. And we will become less and less relevant, even if we are an amazing claims payer. Now, we've got to go pay claims. We got to go have our membership cards, be mailed on time. But if we don't do these other things and take advantage of our market position, we are doomed.
Very, very compelling words from Mr. Rob Coppedge. I don't know if we're going to be. Okay, I don't know if we're going to be joining Mark Stryker, joining us, or yeah.
Enter from stage left.
Okay, enter stage left.
Enter stage left.
Mr. Mark Stryker.
Good to see you, Rob.
Good to see you, Mark.
How's it going?
Just
Doing
wanted
great.
to make sure that Mark had a
Good.
chance to talk with Rob, because I know with your perspective and your experience, you have a lot to say. So.
Yeah. So, Rob, I know that you guys have had a big evolution in here. What are you guys doing to now with the Grove Initiative and those types of market presence for the incubation and the startup community to kind of keep the vision going?
Yeah, no, it's a great question. Thank you. I mean, so we know that just building innovative, early stage, growth stage companies is a necessary act, and the market needs it. But unless we figure out how to get legacy, established, scale businesses to connect more effectively with these innovative early stage companies, we will never have the transformation that our cause asks of us. So you mentioned earlier about how to gear the larger enterprises to be able to work with earlier stage businesses. We're doing that inside Cambia, but the Grove is a space we've launched in the Northwest to be able to have other large enterprises, delivery systems, other health plans, large employers, to find ways to effectively partner and innovate with early stage companies. And we know it's not just about meeting them, and not just about putting logos on the slide deck saying, hey, we're being innovative partners. It's actually about how do we get pilots into works? Because capital has not been the problem for the past 5 years. What's been the problem is how do we get a faster proof of concept that this innovation works or does not, so that their startup can be able to pivot. In healthcare, it takes 18 months to learn these things that should take us 6 months to learn. So we're setting up numerous innovation partnerships through the Cambia Grove in Seattle to be able to have those larger, later stage enterprises in our markets become innovation partners.
And then how do you throw a thread of intention, of activity, of conversation even, all the way across to the other end of the country, per se, to like the Guidewell innovation team, which we all know each other.
Yeah.
But what's the right way to evolve kind of the interrelationship and the interaction?
There are so many ways, and I love that question because there's only so much we can do in any market. And the things you're going to be learning at Guidewell and in the work you're doing in Florida, it's so relevant to our market in the Northwest. And to be able to have established linkages between what's going on in the Northeast, going on in the Northwest, going on in California, going on in Florida, because all the innovation, even though despite the press, is not coming out of Silicon Valley or out of Cambridge. In healthcare services and IT, it's coming out of many other markets across the country, and we need to have those markets linked together to get scale. So we are wide open in terms of our openness in the Northwest to find ways to build those wormholes between our innovation clusters and yours.
Yeah, great. And a lot of other ones out there too.
Absolutely, absolutely.
Yeah, I think that'll be the interesting kind of evolution now, is to take the ones that have been kind of the very, very early stage incubator-ish type of initiatives to maybe the more enterprise-focused and business implementation-focused initiatives.
I think you're right. I do not think the problem that we have in healthcare is the need for more great ideas. I think we have a lot of great ideas in healthcare. The challenge is, how do you take some of those great ideas and get them to scale with partners that can shorten that innovation cycle from 18, 24, 36 months, where a startup company can't survive that long, to be able to bring it down to 6 months, 12 months. And that's where being able to work with partners like the ones we're talking about here makes all the difference in the world of getting innovation from being in a slide deck to being into practice and helping patients.
And that to me is kind of the start of a virtuous cycle at that point, right? Because
100%.
You've got capital efficiency at that point in those compressed time frames. Everybody stays whole longer, got the opportunity for better business outcomes.
And what it requires is that these startups actually become really smart about the kind of the hard and boring things that are at the heart of the healthcare industry. Drawing a better system on a napkin is really easy. We could all do that. What's hard is figuring out how to take that better system you draw on a napkin and make it fit into the constraints that we are locked into in healthcare, and where we can explode those. But we can't explode all of them. I mean, this is not. It would be better if we had flying cars. However, flying cars are, you don't have gas stations and you don't have levitation yet. So let's go figure out how we solve the traffic problem in a different way. Yeah.
Yep.
All right, terrific. Well, gentlemen.
Great perspective.
Yeah, thank you so much, Rob.
Thank you.
And Mark, I knew that you would ask a lot of great questions for us here.
As usual here and there.
All right. Well, I know that we're going to be up in just another moment with the next interview. So, Rob, thank you so much for joining us
having me.
in the Guidewell Connect
Thank
Insights
you.
Lounge. We'll be back up soon. Thanks.
See you shortly.
Thanks. Bye-bye.